MGM New Bombay Hospital is a constituent unit of MGM Trust. The journey of MGM in healthcare goes back a long way. It is the creation of our visionary chairman, Shri Kamal Kishorji Kadam, who after his post-graduation from IIT decided to go off the beaten path. Unlike his friends and colleagues who traveled to USA or joined some multinational companies, he organized a small group of doctors and engineers with Shri Ankush Raoji leading the team of implementation. There, the seed of social and healthcare services was sown, and today it has blossomed into a conglomerate of medical education and healthcare institutes, MGM. The goodwill and blessings of innumerable patients is the wind beneath our wings.
We all work as a coherent team. We all know what our respective roles are.
Hello, MGM Hospital, emergency.
Dr. Kishore, patient is not responding.
MGM has given me my second life.
When I came to MGM, everything they had a solution.
Thousands of satisfied patients are an invaluable asset of this hospital.
I would like to acknowledge and thank all those who have been part of this incredible journey.
We are fortunate enough to have a management who is constantly behind us to upgrade our nurses.
I really feel proud to be associated with this institute.
The year was 1982. The first step on this journey from a small seed to a conglomerate was establishing a healthcare center in the small village of Neela in Nanded, along with a mobile van clinic. Now it has grown into 7 hospitals and 7 peripheral centers with more than 2,000 beds, 225 critical care beds, sophisticated laboratories, world-class radiological services, 40 state-of-the-art operation theaters, with facilities to perform complex, cardiac, neurosurgical, organ transplant and advanced robotic surgeries.
It is said that the seed of an institution casts a long shadow, and under this shadow, MGM has trained lakhs of students in medicine, nursing, physiotherapy, biosciences, engineering and technology, and most importantly, treated millions of patients. To achieve this, our chairman gave us 4 things. The first one is autonomy, then total support, third one is adequate resources, and most important of all of them is a big dream.
25 years ago, this dream was passed on to this man, Dr. Nitin Kadam. In February 1993, he accepted the challenge of reviving a defunct Jijamata hospital, plagued by labor issues and constant failures. Under the guidance of Dr. Sudhir Kadam, all issues were resolved amicably. Today, this tertiary healthcare referral center stands as an impressive visage of modern medicine. MGM New Bombay Hospital, Vashi. This is a showcase of millions of stories, of emotions, of hope. This Silver Jubilee year is an achievement, a milestone on the journey of this hospital. Dr. Kadam, accompanied by Dr. Kalyani Seth, Mr. Sashankar and a skilled, passionate administration team transformed the once dilapidated structure into one of the top 10 multi-speciality hospitals, not just in Mumbai or Western India, but the entire country.
At the outset, I would like to acknowledge and thank all those who have been part of this incredible journey. I would like to thank the patients who have given us this opportunity to serve them. Every feedback and suggestion given by them has helped us to continuously improve our quality. The biggest difference that MGM has made is change the healthcare landscape of this region and has brought world-class super specialty healthcare within the reach of the people here.
In the last few years, the hospital has consistently ranked among the top 10 hospitals in the Times of India's All India Critical Care and Multi-Speciality Hospital Ranking Survey in nearly every super speciality service. The hospital is NABH accredited. The labs are all NABL accredited. They are working towards JCI accreditation for the hospital and CAP accreditation for the labs. Every aspect of the hospital is keenly monitored to keep them abreast of international standards. Above all else, for the people of Navi Mumbai, MGM Hospital is like a lifeline, a place where technology and humanity coalesce. The line between life and death is a fine one, yet this hospital walks this fine line day in and day out with precision and great focus.
Hello, MGM Hospital, emergency.
Every day, emergencies burst in through the door. A fleet of ambulances is always prepared and ready to go. Be it an accident, a heart attack, a stroke or any other emergency, the A&E department at the hospital is prepared for every case.
Looks like a stroke patient. We'll get the team ready. Come.
The patient is on the way with stroke-like symptoms. Immediately upon entering the hospital, the emergency team swings into action.
Hello sir, I am Dr. Rahul Shah. I am the emergency physician.
Diagnosing the patient, checking vitals, and charting out a plan of action.
Can we activate the code stroke?
Code stroke in emergency. Code stroke in emergency.
The code stroke is announced over the hospital-wide PA system, and all related departments are ready to receive the patient at a moment's notice, prepared for thrombolysis or a thrombectomy. Another emergency code is the code blue.
Are you okay? No pulse. Activate the code blue and you start with compressions. You start to take care of the airway.
Announced when a patient shows no heartbeat and is unresponsive.
Continue with the compression 38:2.
These codes are the way this hospital communicates in an instant with the emergency team and handles these emergencies.
1, 2, 3, shot.
The code blue and code stroke team are on standby 24/7 to ensure that lives can be saved and morbidity minimized. The A&E team has saved innumerable lives because they have consultants in emergency medicine who man that department round the clock. They are supported by a full-time neurosurgeon, a plastic surgeon along with orthopedics, surgeons, physicians and highly skilled and dedicated nurses and technicians.
In a code stroke, we have a team defined to do every job. The CT and MRI technician is in the code stroke team. As soon as he hears a code stroke, he stops all the investigation, all the scanning which he is doing. He clears the patient out and keeps the MRI and the CT scan machine ready for the patient who is coming. We have a special ICU team who comes down to tackle with the patient, tackle with the relatives, explain them the condition. The standard which other hospitals or other institutes they have, or what is being published in the journals, it is 60 minutes. But we try to make it as less as 30 minutes.
The scene is no different in the multiple operation theatres where complex, life-saving surgeries are performed. This patient is being wheeled in for a very complex oncosurgery. The case is a critical one. Surgery could last for 4 to 6 hours. The patient will be given anesthesia while sitting up, which is not a routine procedure, as Dr. Kadu explains.
Today there is a very interesting case in our operation theatre. It's a 68-year-old male patient with a breathlessness in a supine position. Diagnosed to have a superior and the anteromediastinal mass syndrome. The mass is very large, it's almost compressing heart and the major vessels. At the same time, our airway is suppressed. So we are planning awake fiber optic in a sitting position.
This surgery will now be performed by oncosurgeon Dr. Rahul Manjare and his team. The OT complex has a total of 6 theatres, including one for robotic surgery. Each of these theatres adheres to every international standard of care. The infection control team is very vigilant and compliance with the antibiotic policy is monitored strictly. Every day, a number of surgeries are carried out here. They range from emergency to elective surgeries, from minor to supramajors, from minimally invasive to complex, open surgeries. Each of these procedures requires precise teamwork. Let's hear about it from the surgeon herself.
The anesthesiologists, the technicians that are there, the OT theatre nurses, the surgeon, the assistant surgeons, we all work as a coherent team. We all know what our respective roles are. We all know what we are dealing with. This is not a body in front of us, this is a life, and this life has got value, and his loved ones are waiting outside for him or her to come back to them. So that responsibility is always there at the back of our minds.
And this responsibility allows the surgeon's skill and mastery of their craft to take over. Complementing that skill is a competent team of anesthetics who specialize in cardiac anesthesia, neuroanesthesia and nerve blocks. This skilled team ensures that the patient has a smooth and streamlined journey in the roller coaster periods of hemodynamics during the surgery.
Our Department of Anesthesia, which includes highly experienced anesthesiologists, makes continuous efforts to deliver outstanding clinical care to all age group of patients in perioperative period, which includes acute and chronic pain management. We not only give anesthesia to the general surgeries, but also other super specialties, which includes liver transplants, kidney transplants, robotic surgeries, polytrauma managements, neurosurgery, orthopedics, cardiac, and other obstetrics and gynecological surgeries.
Satyavan, Dr. Kishore, patient is not responding. Are you okay? Are you okay? Dr. Manoj, you did the CPR.
The intensive care units also play a key role in the recovery of complex cases. This is why MGM Hospital has a robust intensive care unit consisting of a 10-bedded cardiac care unit, a 12-bedded surgical intensive care unit, a 12-bedded medical intensive care unit, a pediatric intensive care unit, a transplant ICU, 4 isolation ICUs, a fully equipped 12-bedded NICU, plus specialized positive pressure isolation rooms for the care of immunocompromised patients. All of these units are under the capable watch of experienced intensivists and staff.
Our ICU is well equipped with all the advanced machineries, including the bedside monitors, the defibrillators, the advanced ventilator, as well as the hemodynamic monitors. We are having a IBP machine, and the bedside dialysis facility is also available with us.
We are very particular about the standard guidelines and protocols. We are strictly adhering to all the international standards. And along with that, I am very proud to say that we are having regular academic activities, which include journal club, case discussions, seminars, etc., so that our people are well versed with the recent guidelines and they are well updated. Along with that, we are having a training program also for IDCCM course. This course is affiliated by Indian Society for Critical Care Medicine, and every year our students are topping this exam.
These same departments also play a critical role in one of MGM Vashi's biggest achievement, the transplant program. It offers live and cadaveric transplant facility to the patients. At present, they perform kidney, liver, corneal transplants and have applied for permission for a heart transplant. They will also be starting bone marrow transplant in the near future. So far, they have donated 7 hearts, 21 liver, 44 kidneys, 1 lung and several corneas to the state organ pool. In fact, the donor heart for the first heart transplant in Mumbai city after a hiatus of nearly 47 years was harvested at MGM Hospital, Vashi. The hospital regularly promotes organ donation for the cadaveric transplant program through talks in the community, various social events, in festivals like the Ganesh Festival and during their annual walkathon held in January, which is attended by thousands of people. For the past 6 years in a row, they have been felicitated by the Zonal Transplant Coordination Center, acknowledging their immense contribution to the development of cadaveric organ transplant program in Maharashtra. The first liver transplant at MGM was successfully carried out on the backs of its immaculate infrastructure. That liver gave a new life to Subodh. Today, a healthy Subodh has come to the OPD accompanied by his sister for a follow-up with Dr. Ravi Mohanka.
This patient was suffering from liver failure, which means that he was suffering from jaundice and he was suffering from a lot of ascites. Ascites means fluid in the abdomen. Luckily, there was a donor who was in this hospital and the family decided to donate their organs after the donor's death. From that donor, the patient was given the liver and he underwent a successful transplant and he recovered really well after the surgery. So liver transplant is a very high-end surgery and requires a good infrastructure, a very well-experienced team and a lot of facilities, which fortunately we have been able to develop as the first one in New Bombay.
Many aren't as fortunate as Subodh, like these patients who suffer from renal failure. What do they do? Where do they go? For them, MGM runs this massive dialysis unit to help these patients survive while they wait for a kidney to become available. In fact, there are cases of patients being on dialysis at this unit for the past 15 years. This was the first dialysis unit established in Navi Mumbai in 1994 with one single machine.
We use state-of-the-art, high-tech, new dialysis machines. We have about 29 of them, out of which we have segregated separate machines for hepatitis B and hepatitis C patients, whom we do not mix with the other regular patients. The plus point is we take meticulous care to ensure cleanliness, hygiene, and we also have a very good RO plant, which is very critical for good working of any dialysis department, and the water is tested time to time every month and ensured that it is safe for use with our dialysis patients.
Beds are also been modified as per their comfort. They can take any position whatever they want. We also provide food over there as per the dietitian's recommendation, because we want to maintain them healthy. We are starting over with a new program, that is physiotherapy or exercise during dialysis, by which, as per the new concept, by which you can keep patient fit and healthy. And the study has shown that by doing exercise during dialysis, the heart is maintained in good condition.
All the wait is worth it when you do receive a kidney. Just look at these two. There may be a vast difference in their ages, but their experiences are very similar. They both suffered from acute renal failures, giving them only one option: transplant. Today, they are happily living their lives because of MGM. Mr. Satpute received a kidney from a cadaver donor, but Utkarsha's case was unique because his kidney comes from a live donor, his own mother. Post such a major surgery, he now leads a stable life.
I feel very positive, very energetic, and I do not have any obstacles in carrying out my daily activities. I feel like a normal person. I do not feel anything different. I don't even think about transplant. The staff in MGM was very cooperative and they were very friendly to be. Like, they didn't even make me realize that okay, I was in such a serious condition. And especially I'd like to mention a note on Dr. Deepa Jairam, because it is her personal involvement with each and every patient. I'm not talking only about me, but every patient. She takes that much care and that much importance to each and every case she handles.
Multiple transplants have also been performed by the ophthalmology team here at MGM. Cases like that of Master Lokmanya, who had a defective cornea since birth. By the age of 12, he was on the verge of losing his eyesight. But the doctors were able to perform a successful cornea transplant, granting him a chance at a full and fulfilling life.
With the kind of infrastructure we have in the hospital, especially in the OR, dedicated ophthalmic sisters and the setup and the machinery with good microscopes, I was able to perform a very good corneal transplant. And the results are so good to see. The child is now having a nice clear graft. His vision is very good. Doing these complicated surgeries, especially for young children, doing a keratoplasty or a corneal transplant for young children We need good infrastructure, we need well-trained staff, we need expert surgeons. At MGM Hospital Vashi, we have all of them together here under the same roof.
It changes the refractive index of your eye and it causes the number to come. Okay, does it go away by itself or do you blink and then it goes away?
There are many more gut-wrenching stories of patients. Someone whose ocular muscle got so weak, he lost vision in his only seeing eye.
ये यहाँ से ब्लेड टूट के 4-5 टुकड़ा हो गया, चश्मे को तोड़ के और अंदर में डैमेज कर दिया।
Another one whose retina was shattered by a piece of a grinder blade hitting the eye.
बस खड़ी थी ना, उसने उसको मार दिया जाए। तो मीटर है ना, आँख पे लग गया।
And someone like Mastambi, who hit her head on a rickshaw meter during an accident.
When I saw the patient at night, maybe around 12 a.m., I saw the patient. The eye was filled with blood completely and grossly swollen. I was not able to see anything. So we had to post her immediately. Otherwise, infection would get in and we may have to remove the eye completely. So we have to salvage the eye. Hence, we posted her. We did the surgery. It was a big surgery. This surgery was done by Dr. Sunita only. And post the surgery, maybe again after 2 to 3 weeks, we were so happy to see that her vision has been restored, and from 0 to it has gone to around 50 to 60%. Madam, ये कौन सा number है?
9325.
To achieve this level of vision, Mastambi underwent 3 extremely crucial surgeries, and her vision was restored because of the efforts of the doctors at MGM. This is just one of many achievements for them of giving back the gift of sight to patients like these. The ophthalmology department is fully equipped to deal with all ailments of the eye related to the anterior segment, posterior segment, retina, cornea, right up to complex transplants. One of the breakthrough surgeries performed here at MGM was the autologous limbal stem cell transplant. The patient had suffered a horrific chemical injury at his workplace and arrived at the hospital with a burnt cornea.
In such burned corneas, it is very difficult for us to retrieve those stem cells which can make the cornea clear back again. So we tried to take a small bit of tissue from the patient's burnt eye. We grew it in our genetic lab with the help of Dr. Bani Ganguly. And fortunately, we were able to grow those cells. So all I want to say to the patients who are coming at MGM Vashi in the ophthalmology department is that don't lose hope. The ray of vision may be lying somewhere in the corner in the department of ophthalmology.
This ray of vision was developed in a lab through the support of the Genetic Research Center led by Dr. Bani Ganguly. Dr. Ganguly is a keen researcher and an academician with hundreds of publications in prestigious national and international journals. Dr. Ganguly's own research on the Bhopal gas tragedy is world-renowned and has garnered many accolades.
We do genetic analysis here for research and diagnosis, and this diagnosis is for the detection of heritable, means that heritable abnormalities. The abnormalities can be passed on through generations, and these abnormalities cannot be treated, it can be prevented. But generally we do mostly diagnosis of heritable disorders in the blood sample and abnormalities of the blood cancer. I told you, like blood cancer, if we can detect the correct abnormality, then the patients can be treated with correct medicine and they can come to normal condition. We had participated in a clinical trial testing also. That clinical trial was an international trial of Bristol Myers Squibb, and we had offered the diagnostic services totally.
MGM has a whole plethora of super specialty services lined up to serve the community. The cardiology team is staffed by dynamic cardiologists who are well versed in procedures like IVIS, rehabilitation and many others. The team in the cath lab is preparing for an angioplasty.
This is a patient being prepared for the right hand artery function.
The hospital has set up an entire team available 24 hours a day, 7 days a week and 365 days a year for primary angioplasty. Through protocols like Code PAMI. MGM is not just living up to, but even surpassing national and international guidelines. Just like the cath lab, the OPD is also equipped with state-of-the-art equipment. Here, Dr. Lahoti has access to machines like the cardiac stress test and others, which makes diagnosing a patient and charting a treatment plan easier.
A lot of complex cases are handled here, like left main bifurcation disease, heavily calcified coronary vessels, chronic total occlusions. All these cases are dealt skillfully. Newer technologies like fractional flow reserve, intravascular ultrasound, rotablation, optical coherence tomography can be executed here. We have performed more than 2,500 angioplasties, including more than 300 primary angioplasties during the golden hour of heart attack, more than 500 cardiac surgeries with very good long-term results.
We have two sets of technical staff with us and they know everything. They work by reflex. They already know one step in advance what is required for a cardiologist to do his or her work. They know as to what sort of views and angles are required to get the best images of a given patient. You know, when the patients look at us, they tend to forget about the staff, but it's so very important that they have been our backbone. We have practically unchanged cath lab staff since the last 10 years, and that has accounted for a lot of support and patience we have when we do these procedures.
The cardiovascular and thoracic surgery department performs complex procedures like coronary artery bypass graft, congenital heart surgeries, valvular surgeries, permanent pacemaker implantation, and vascular surgeries. In the special cardiac imaging facility, Dr. Jadhav is using the cardiac CT to get a better look at the patient's coronary arteries. This diagnosis will help him plan out any interventions if required. The Department of Cardiac Imaging has technology that provides an examination of coronary arteries and myocardial status. The ultimate goal of this department is to improve the prevention of coronary heart disease by CT coronaries and cardiac MRI. The Radiology department has world-class imaging machines like Navi Mumbai's first 3 Tesla MRI, a 160 slice CT scanner, a bone densitometry machine. Even the routine X-ray and ultrasound machines are of the highest standards. MGM constantly emphasizes diagnostics because to treat any ailment, your diagnosis has to be perfect. Which is why, be it radiology or the pathology lab, you will see it fully equipped with the most advanced machinery. The pathology team is busy corroborating the findings of the lab technicians before final reporting.
It doesn't look like glioblastoma, it looks like lymphoma.
A new batch of samples collected from the various patients in the hospital is regularly delivered to the pathology lab.
Vijay, कौन से samples हैं?
CBC एक मैडम urgent blood group है. We have a specialized laboratory here. This is a fully automated histopathology laboratory where we have a fully automated grossing station, then analyzer, histokinete, then automatic stainer, block maker, that's also automatic, and we can do we routinely sectioning around. Similarly, we have cytology, liquid-based cytology of pap smear screening, as well as means gynec cytopathology, as well as non-gynec related to fluids. And for that, we have the cytocentrifuges here. Similarly, another section which deals with that is biochemistry, which is a vast section, providing almost analyzing 1,500 to 2,000 samples a day. Huge section.
कोई parameter out नहीं गया ना?
Even with this volume of investigations being performed, these technicians provide 100% accurate and prompt results every time. That is because many of the staff here have doctorates and masters in pathology with an experience of over 3 decades. At the microbiology lab, the technicians are busy analyzing blood culture for various bacterial, viral and fungal infections to provide a proper diagnosis. It is equipped with sophisticated machines like the Bacti Alert, the Vitek and the recently introduced Gene Expert machine. The team of microbiologists also heads the infection control unit.
We are also looking into infection control, and we ensure the things that the antibiotic policy is being implemented robustly, as well as all the infection control practices compliance is near to the 100%, so that patient will not acquire hospital acquired infections. And to ensure the quality of our reports, we are doing regular ECAS, external quality assurance programs. We are participating, and internal quality assurance program, so that to ensure that the reports that are being generated in our lab are as per the national and international guidelines.
The Infectious Diseases Department headed by Dr. Divyashree also benefits from the prompt diagnosis of these labs.
Infectious diseases is an evolving branch in India, and MGM is one of the very few hospitals in India to be having a dedicated infectious diseases department. Globally, 20 million deaths happen because of infectious diseases, and India is no different. Nowadays, we see a lot of deaths because of increasing antimicrobial resistance, because of extensive drug-resistant tuberculosis, and there are also new infections like a Zika virus or a Nipah virus. So at MGM, with very good lab backup, radiology backup, we are able to handle all these patients.
A strong lab and radiology backup is key in providing an early and accurate diagnosis for many ailments. One of the major ones is cancer. Cancer, this single word had wiped the smile from Vaishali's life. But she overcame this challenge and became an MGM winner. The MGM Winners program has been developed as a support group for all cancer patients in the hospital. It holds regular meetings with talks by doctors and other patients who have survived cancer. Today, when Vaishali visits MGM and meets one of the nurses who was present during her treatment, her smile is absolutely radiant.
डॉक्टर आके कभी-कभी रुला के जाता था, ये हंसा के जाती थी.
The staff and Vaishali share a laugh while she waits for her doctor. Under Dr. Lokeshwar's treatment, she started improving. Her smile returned, her infectiously jovial nature surfaced.
Your friends I must never forget because they support you.
Yes.
Sitting with you, making you eat, eating with you, eating for you and everything else.
Even the canteen people, मैडम को ये खाना पसंद नहीं है तो वो लेके आप watermelon juice लेके आओ.
She's a star. She's a star.
And she became a proud part of the MGM Winners.
When I came to MGM, everything they had a solution. बहुत कम हॉस्पिटल्स में ऐसा दिखाई देता है जो पर्सनल टच है वो हर कहीं पे नहीं. Even nurses, they used to pray for me and then they used to give the injection या medicine. We have prayed for you. रोजरी बोला है मैंने, मेरे हस्बैंड को भी बोला है प्रेयर करने के लिए तुम्हारे लिए. तो मुझे भी लगता था अरे एक ही पेशेंट को लगता है इधर. ऐसा फीलिंग मुझे देते थे वो लोग. Very close or warm.
This is the story of just one out of many MGM winners, and this department has been at the center of it all.
So we have a medical oncologist. In fact, we have 3 medical oncologists now. We have hematologists, we have a surgical oncologist, and a comprehensive care is available here. Right from screening of cancer to prevention of cancer to early diagnosis, most pathological advanced techniques are available. We do testing for molecular studies, we send samples for many of the newer investigations today. And with that, we are able to offer our patients much better treatment.
They perform robotic surgery, especially for prostate and rectum cancers. The treatment of chemotherapy forms the backbone of the cancer treatment here. MGM has a daycare center for patients undergoing chemotherapy. They also have a psycho-oncology department to provide psychological support to these patients.
basically this daycare chemotherapy is a part of our medical oncology services, where we give chemotherapy, targeted therapy and immunotherapy to patients. We have a laminar airflow where the chemotherapy is formulated under strict aseptic precautions. And we also have inpatient facility. Along with the chemotherapy, we also administer targeted therapy, which is specific therapy which is directed towards the cancer cells only, and it has minimal side effects. And a newer modality like immunotherapy, which is the recent advance in the cancer treatment field.
MGM has almost all super specialty established departments, but looking at the future and the increasing burden of cancer in our society, I visualize that in near future, MGM should have a dedicated cancer unit, complete with all the facilities like radiotherapy, PET scan, nuclear medicine, gamma knife, molecular diagnostic, immunology and genetics, giving us an edge over the disease.
And now, let's experience the story of a phoenix rising from the ashes of a helicopter crash.
Taken off from Ranchi, and then suddenly after 50 minutes, there's a huge loud bang and the helicopter went towards the ground. We were about 1,000 feet.
This is a pilot's story. A pilot who has flown many national and international dignitaries safely to their destinations. Colonel Alok Sen, a helicopter pilot in the Indian Army. The day of his crash will forever be etched in his mind. This crash in Jharkhand resulted in a crushed vertebra and compressed spinal cord, which meant that Colonel Sen had lost feeling in the lower half of his body. He was immediately airlifted from Jharkhand to MGM. Dr. Divre successfully operated on him. The surgery lasted for 7 to 8 hours.
His name was Bandhu Tirki. I think he was the education minister or something.
Today, both of them are recalling those memories of the time following that fateful crash.
Captain Sen had fracture of L3 and L4 vertebra, that is in the lower back. And because of the fracture, there was a pressure on the spinal cord causing weakness in both his legs. So he was evaluated clinically and we had done his MRI also. So, and then we took a decision that he needs surgery to decompress his spinal cord so that he can recover neurologically, so that his power in both legs can come back to normal. And we had to stabilize his fractures also so that he can get back to his daily routine and flying.
After the surgery began Colonel Sen's journey towards getting back into the cockpit of a helicopter. Another department at MGM played a very important role in his rehabilitation, the physiotherapy department.
I wanted to thank you for the excellent recovery I had after the surgery.
Walker was just 1 or 2 days.
Dr. Manju Khediar and Colonel Sen are talking about his miraculous recovery and his amazing urge to get back into the air.
After 8 months, I sought an appointment with Institute of Aerospace Medicine at Bangalore and went for the medical. And in the medical, they checked me out and did all my physical tests, and they were very impressed with my recovery, but they said that technically it is not possible to clear you so early after the surgery. So you come back after 3 months, and after 3 months we'll examine you again, and if everything is fine, we'll clear you. So 3 months later, they cleared me without any condition, and ever since I continued to fly without any problems.
Even after his retirement, look at his fitness, his enthusiasm as he plays tennis every morning with a group of his friends. At the forefront of many such miraculous recoveries is the physiotherapy department. It is a multi-speciality department in itself. Physiotherapy is a rehabilitation science with an emphasis on maintaining and improving the functional activities of the patient. Its ultimate goal is to make the patient pain-free and functional.
पंजा खेचून घे.
That is achieved here with the use of these machines and various physical therapy styles.
Various domains are taken care of in our department, that is cardiac rehabilitation, we have neuro rehabilitation, that includes adult and pediatric cases. Then we have musculoskeletal orthopedic cases, and now recently we have started with renal rehabilitation that takes care of the patients' functional activities who are regularly on dialysis. Then we also have oncophysiotherapy that takes care of the cancer patients.
This department provides rehabilitation services for a range of super specialities, be it spine surgery, neurosurgical conditions or joint replacement surgeries. Dr. J.P. Jain is a skilled joint replacement surgeon with the vast experience of thousands of joint replacement surgeries under his belt. Today, his patient, who is a retired railway officer, has come to the clinic for a follow-up.
Do the other side.
He was suffering so badly from arthritis that even walking from one room to another was a journey of pain for him. But Dr. Jain operated successfully upon him. Now, after his surgery, every step is a wondrous feeling of freedom from pain and dependence on others.
Within a month post-operation, I am feeling excellent. I am able to carry out my daily routine activities. I am able to take rounds of my compound, and I am performing all my normal activities.
MGM Hospital has a good joint replacement department. It has all facilities which are required for knee replacement surgeries are available. It has the excellent OT setup, and we have excellent post-operative facilities to take care in intensive care unit, which is required to be kept after the surgery. This gives a more than 99% success after the knee replacement surgery.
The success ratio can be seen in the long and ever-evolving list of super specialty care centers, like this endoscopic center. Dr. Satish Kulkarni is a gastroenterologist here, heading this advanced center with equipment like a gastroscope, duodenoscope, colonoscope, and the most advanced endoscopic ultrasound. Patient safety is given the highest priority through automatic scope cleaning and disinfecting machines. This center of excellence performs high-risk, complex diagnostic and therapeutic procedures, not only for outpatients, but also for critically ill patients admitted to the hospital. Another important department here is obstetrics and gynecology. It deals with the most complex high-risk pregnancies and preterm births. It is headed by a doctor who has been with the hospital from the beginning. The women and mothers of Navi Mumbai have benefited immensely from his expertise over the last 25 years. His experience speaks for itself.
So I'm right from day one working with this institute as an obstetrician and a gynecologist. When we started, this place was practically nothing, and today this place is considered as one of the tertiary care center. It is considered as one of the good one, leading institute, not only at the level of city level, state level, but I can proudly say that even at the national level, there is a name MGM's New Bombay Hospital, Vashi, and I really feel proud to be associated with this institute.
Dr. Boricha is also a prolific teacher who has molded many competent gynecologists like Dr. Tanushri Sengupta.
We deal with a lot of difficult gynecological cases like large multiple fibroids, grade 4 endometriosis, uterine, cervical, ovarian malignancies, and to deal with such difficult cases, we have a lot of technological improvements which are continuously made for the patient's safety and their treatment, and we have so many senior gynecologists here that we get really very difficult and interesting cases which are generally not seen elsewhere.
While Dr. Buricha and his team care for the mothers, the NICU is completely engrossed in taking care of the infants ranging from a few weeks, a few days to even a few hours old. They have an inborn section and an outborn section with open warmers and incubators in each one of them. They have ventilators, including one for high-frequency oscillatory ventilation, numerous phototherapy units and all equipment required to care for these little ones. The NICU is staffed 24/7 with nurses who keep a gentle yet keen eye on every vital and every cry uttered by these babies. They have handled very complicated preterm birth babies as well.
Recently, we had a baby which was 710 grams at birth. That's an extremely low birth weight baby. The baby suffered from multiple complications, but due to the hard work of our staff, we managed to send that baby home. Today, that baby is 3 kg plus, and the mother is very happy. We have also saved a number of babies in the 800 to 1000 weight group, and all of them are doing well. Some of them are 8 to 10 years old now, and we are really happy to see them developing and doing well.
We also see babies, okay, the baby's retina, especially babies who are born prematurely. Such babies, their retina is not usually developed because these babies are born before the time. So they suffer from a disease, what we call it as retinopathy of prematurity. So as you know, babies can never say that they are having a problem or they are seeing less. So it is our duty as eye specialists to see their retina, especially the babies who are premature. So that facility is available in very few hospitals in Bombay. So that facility is there in MGM. So we have babies coming from our own NICU as well as different NICU whom we screen it at regular intervals.
There are many such stories, like that of a couple with a 6.5-month premature baby in critical condition. They were sent back from 3 different hospitals.
Then they came lastly to MGM Hospital somewhere at morning 4 o'clock. They called me, sir, ऐसे couple एक बच्चा लेके आया, hardly 6.5 months का है pregnancy, क्या करने का? मतलब chance ले लो, उसको admit करो. Then we admitted mother also admitted that child in NICU. 2.5 months that बच्चू was in hospital, got well, अच्छे हो के उन लोग चले गए. And around 7 lakhs was there. Sir ने बोला छोड़ दो इसको.
Such is the generosity of the MGM Hospital, Vashi. The hospital's journey over the last 25 years has been dotted with millions of such stories, and the biggest milestone on this journey was the introduction of robotic surgery to the healthcare landscape of Navi Mumbai.
Here the robot will filter the tremors. If I move like this, it will start rotating the instrument.
MGM was the first hospital to use the Da Vinci surgical system.
We can reduce the height or increase the height and control the foot panel.
This allows doctors to transform complex surgeries into minimally invasive surgical procedures, and patient safety has increased manifold.
The safety factor is taken care, so it doesn't damage or it doesn't do any harmful thing to the patient.
The advantages of this surgical system are innumerable. It is a boon to the patient, as a doctor can now perform precise movements with utmost dexterity, moving and rotating the surgical arm in multiple planes.
All 760-degree rotations and all different angles of movements can be performed through the joysticks.
It also enables surgery without having to make a large incision or cut through several layers of connective tissues.
The indications of robotic surgery are many, but most of the uses are in cancer control, oncology. Indications like prostate cancer, kidney cancer, urinary bladder cancer, and colon cancer. Now we have conducted complex radical prostatectomies and partial nephrectomies with the help of robot.
What are the advantages of having a robot? A robot minimizes the pain to the patient, early recovery to the patient, and early resumption to the activities or the routine life.
This surgical robot is incomparable and has revolutionized the approach and results of cancer surgeries. Under Dr. Mangesh Patil's guidance, many surgeons are being trained to operate this surgical robot.
Sister, can you take out the needle driver and put a scissor?
Technology will always be important, but there is another important aspect to MGM, the human touch. Through all these super specialities, the various wards, the intensive care units, one figure stands strong and unwavering. The nurse.
Sister, 6:30 emergency.
The highly trained nurses here are manifestations of three words that form the cornerstone of this hospital: care, compassion, and cure.
Now, as we trend on the delicate lines between tradition, technology, mastering computer skills, and providing compassionate care, I think at MGM Vashi we are fortunate to have a group of nurses who are having 2 decades of clinical experience, and with the new advancements in medical science, with a lot of new things coming in, like robotics what we have here, and going up to liver transplants, I think we are constantly on the move to educate our nurses, to build their skill sets, their knowledge, and I think we are fortunate enough to have a management who is constantly behind us to upgrade our nurses.
As you may have noticed, the hospital is always ahead of its time in equipping each of their care centers. They use the most advanced US FDA approved equipment in their Cosmodem Skin Clinic. All kinds of laser treatments for scar reduction, pigmentation, acne removal are performed here. The dental clinic performs everything from routine procedures to complex maxillofacial surgeries.
Bariatric surgery reduces intake, it doesn't starve you.
MGM also has a bariatric surgery department which aims at giving people battling obesity a lifestyle change. Running such a huge hospital also generates a large amount of biomedical waste. This waste is collected, properly segregated, stored and sent for proper processing and disposal as per guidelines. The hospital functions smoothly on the back of a well-trained staff. A robust security team which is trained to tackle any emergencies, and an experienced team of firemen. Under the able leadership of Mr. Sashankar, the administration team runs like a well-oiled machine. MGM is blessed with an excellent staff and proficient doctors. They have a very strong team of full-time consultants in all specialities and subspecialties. MGM presently employs more than 1100 healthcare workers and has given indirect employment to countless others. The 250 plus beds in the hospital are efficiently spread across the general ward and private rooms. They even have a section in each ward for indigent patients. The hospital provides its full services to patients from every stratum of society through various government social healthcare schemes. Through these centers, several camps and outreach initiatives, MGM provides community services, performs health checkups and spread awareness about various health issues. MGM Vashi is well on its way to accomplishing its mission of creating affordable and sustainable healthcare for the entire community.
Today, medical science has done wonders by extending life expectancy and improving health for all ages. But these advances come at price, and our mission to provide affordable and sustainable quality healthcare for community is a very difficult balancing act. I believe that if the talented young generation of engineers, scientists and entrepreneurs of our country come together to solve this universal problem and make technology affordable and within the reach of the masses, then our dreams can surely be achieved.
To maintain this high standard of healthcare, the hospital is associated with educational institutions
After we come in contact with any blood or body fluids,
like the MGM University of Health Sciences for academic activities and skill development.
1, 2, 3, 4, 5, 1, 2, 3, 4, 5.
All of this is done with one aim in mind, to give the best to every patient.
We have to be relevant to the rapidly changing technological environment. Healthcare is not constrained anymore by brick and mortar boundaries of a hospital. The current generation is accessing healthcare and their healthcare needs using their mobile phones from the comfort of their homes. We need to be ready for them. There's one topic it's very close to my heart and I would love to talk about it. That is the doctor-patient relationship, which is being questioned now. But I believe this relationship between a doctor and a patient is all about trust and is one of the most enduring and the most endearing, provided we learn to see not only with our eyes and ears, but also with our hearts, also with our minds. It is up to us how we use this gift of healing for the betterment of those who need it. It's really in our hands. Over the years, we have experienced innumerable heartwarming stories of doctors, nurses, staff, how they go that extra mile to bring joy and relief, to save lives, add years to a person's life and bring a smile to someone's face. Once that is done, our job is done. To do justice to this profession of care, compassion and cure, we need to be continuous learners, keen observers, earnest and ethical in our conduct, and more than anything else, we need to be a good team player. Then talent and technology will get the thrust to do wonders and take this organization to new heights.
Another important thing, a nurturing environment which is essential for any organization to progress. The old and new will always coexist. The synergy between the senior and junior healthcare professionals, where the experience and expertise of the seniors meets the confidence, newer skills and knowledge of the recent advances of the younger generation of the doctors, creating an opportunity to learn from each other, especially what not to do. I sincerely believe that the goodwill and blessings of innumerable patients is the wind beneath our wings. I hope and wish this goodwill continues to stay with us in the times to come and we are able to serve the healthcare needs of the community effectively.
The past 25 years have been glorious, not just because of these technologically advanced departments or the drive to develop more super specialty services or to build more and more state-of-the-art infrastructure. They have been glorious because all of this is available to every citizen in the most affordable prices. They have been glorious because of the smiles of millions upon millions and innumerable more. These faces, these smiles converge into one face, one name, MGM New Bombay Hospital, Vashi. Providing care, compassion and cure to all who enter.